Back here with Dr. Nguyen from Route Rock, Texas. How are you, Dr. Nguyen?
I'm good. How's it going with you?
Well, we live in California. It's always good here.
There you go.
Here you go. So, Dr. Nguyen, tell me, we talked about missing teeth, and we talked the havoc they create, all the way up to headaches and migraines, never mind that not looking good, even if the teeth are missing in the back because they're shifting around and all those type of stuff. The fact that because of missing teeth, you possibly can get much more gum disease because it's difficult to floss and brush in between the spaces of which the missing teeth create. So all these problems. So what are the options to fix missing teeth, to put them back in? I'm sure there are several options. Give us a little bit, shade of light on each one of those options in a big umbrella picture. Give us a little bit the pro and cons of each one of those options.
Sure, I'll be happy to. Well, in general, there are two types. When you fix a teeth, one is you do something fixed. That means it will stay in the mouth. You don't have to take it out, put it back in. The other type is called removable, meaning that you take it out, put it back in, and you got to clean it, and when you take it out. The fixed options, there's several of them. The latest one so far, and then state of the art, is the implants, in which you put like a little kind of a post in the jawbone and let it heal, and then you put either you put a crown on it or some attachment on it, like put some teeth on it, so that way you can chew and then function again, okay, looking good again. The other type of fixed restorations is a bridge. It's just the name implies that you got two teeth on either side. You carry some teeth, like you carry the load for some missing teeth in the middle. Okay, and that also is cemented onto your teeth, and that'll be staying in there. You don't have to take it out. And several yes.
So on a bridge, you basically use the adjacent teeth, which is still there, as a post, as you called it, to hold it. Where versus an implant, you take a metal screw, basically a metal rod, and put it in. That metal rod is titanium, right? It's the same one they use for hip operations and stuff like that, right?
Right, it's medical grade, so it's integrate with the bone very well, and that's research has shown that there's really great result with those, and those are the implants and the bridges.
Right.
Okay,
well, the bridge have been around for a long time. Even implant have been around for quite a while. Give us some of the pros or cons on let's say a bridge.
Okay. Well, the pros would be definitely, it's fixed. It stays in there. You don't have to hassle on taking it out, putting it back in, cleaning it in between. You have to clean it just like you clean any out of your teeth. But you don't have to be like taking in and out and running the risk of losing it.
Sure.
The con is that you have to shave the outer teeth. The teeth are chased into the gap, like you said, in order to make room for the crown, to stay on there. So that's the biggest, downside of that. Versus the implant, you basically just dealing with that gap only. You just put a screw in, put a crown in, or put something on there so you have, your brand new tooth again. You don't have to cut anything up pretty much. Okay, beside that gap.
Yeah, I have heard that if you have a bridge, usually it's a 3 units, sometimes maybe 4 units. Basically, you hang one tooth in between of those two other teeth.
Right.
The cows, they're kind of melted together. They're very difficult to clean, and because of it, some lazy people maybe who are a little bit more difficult to clean and put their floss below it and thread it through, that they might then create gum disease and because of it lose the bridge again. Is that true? That's
exactly right. And I've seen that, again and again. And because of the way that the bridge is, it's connected together, and then it's sitting, that tooth is hanging in there, it's sitting on the gum, and some people, you just talking about flossing alone, just your natural teeth, and you don't really, most people just don't want to floss. And then you talk about having to go under that bridge and try to get into that tiny little space. People just, really don't want to do that. And then ending up, having, tartar buildup and gum disease, inflammation, and then you end up losing the whole bridge.
Meaning you lose basically 3 teeth. Now you have to replace those 3 teeth. And
bigger, more, yeah.
Okay. So is there any evidence that an implant holds longer than a bridge, or not really? Or is it too early to say because they haven't been around for that long?
Well, actually, it depends on several factors too. First of all, when you have an implant in there, it's depending on your system. If you recheck the implant, it'll happen right away. Okay, but if it's already staying in there, you're going to pretty much just have it for life. It's not going to go anywhere. Okay. And like I said earlier, you still need to maintain it like floss and clean it just like any other teeth anyway.
Sure.
Okay? But yeah, it's definitely a better solution compared with the bridge in terms of, longevity, in terms of ease of clean, hygiene. It won't get cavity. The bridge, you're still going to get cavity under if you don't get them cleaned up.
Yeah, and let me ask you, if you put one implant in it, because you don't need to shave the other teeth and you don't need to put a crown on those other 2 teeth, is the price of one implant really that much more money than of a bridge with 3 units?
Actually, it's not. That's the nice thing about it. And then think about it. And then if you pay the same price and you get, one implant that's going to stay in there for the rest of your life, and you run the risk, a very minimal risk of gum disease if you take care of it really well. You don't have cavity on it. I mean, that's a total win situation, in my opinion.
Right. Well, all right. However, I guess the worst thing one can do is do nothing. I mean, bridges have been around for a long time. There's something better in down right now, but that does not make the bridge an outdated thing either. Am I correct there, or am I mistaken there?
No, definitely not. You are right. I mean, there's several options, there, like depending on your, point of view, what you want to do with it. Like some patient told me that they don't really want any foreign object in their mouth, meaning an implant. So, but that is just how you view things.
Well, what about the crown? The crown is a foreign object.
I know, but they don't think about it that way because it doesn't go into the bones.
I know. Well, and thanks God that there is the bridge which does do the trick. And maybe sometimes when the other teeth, besides already having problems anyway, they need to be fixed and maybe capped or maybe have big fillings anyway, then it's maybe even it's better to lean towards that because you fix it in one swoop.
Right. That's right.
Okay, good.
So it's basically you need to look at the whole picture and then let the patient decide what would be the best fit for them financially and their belief also.
Right. But in most cases, let's talk teeth in the back. Nobody talks about front teeth. That's a natural that we want to replace them. But teeth in the back, on an average, you think they should be replaced otherwise, one way or the other way. Use a bridge, use an implant, even if needed, use a partial, but replace it so that like a fence that you keep the teeth straight and keep them their function which they're supposed to do, like keep you pretty, keep you without headaches so that the muscles don't get all torn up and you're using them one-sided. Because it's not just about chewing on one side, which people might get used to it. No big deal, so chew on one side. But his facial structure changes and most importantly the nerves and the muscles, and then he can get all those headaches and doesn't know where they come from.
Exactly.
Good.
Yeah,
all right.
Exactly.
Dr. Nguyen, thank you very much. Very enlightening. Bye-bye.
Thank you for your time. Bye-bye.